Have you ever felt that your doctor wasn't taking your pain seriously? I've definitely experienced this myself, and I'm a board certified OB GYN. So let's talk about it. Unfortunately, many women experience medical gaslighting when seeking care. But the good news is you have the power to advocate for yourself, and I'm going to teach you how with my top tips of how to do so. If you're new here, my name is Dr. Odunsi, and I'm an OB/GYN who cares about women's health and cares about you feeling empowered when you go see your women's health professional. My first tip is to come prepared with the knowledge of your medical history, and that includes documentation. I don't want you to come to a visit without knowing what's happened to you in the past. So having a good history and good documentation is going to help clear up any confusion even as you step through the door at the beginning of your appointment. Start by writing down your symptoms, when they started, and how they've impacted your life. This is important for me as an OB/GYN because it helps to focus my attention on what you're saying. And that helps me formulate a list of potential diagnoses and any tests or imaging that I might have to order later on in your visit. For example, instead of saying, I feel off, you can say I've had this sharp pain in my lower abdomen for 3 weeks. I've tried Tylenol, ibuprofen, it doesn't help. And now I'm missing days of work because of this pain. That lets me know this is changing your quality of life. You've tried things already to try and relieve it before coming to see me. And that lets me know I need to take this seriously. This pain that you're having, it could be something serious. This is one example of how clear communication can help to advocate for yourself when you're trying to get care. And it also helps the physician to focus on you, focus on the symptoms that you're presenting, and come up with a plan that we can both agree on that is helpful for you and gives you the best outcomes. Tip number 3 is to bring a trusted advocate or a support person. Sometimes when the physician is talking, myself included, there might be pieces of information that you miss. Having 2 sets of eyes and 2 sets of ears in the visit helps to make sure your questions are answered and also helps with memory and retention. Because when you leave the visit, now you're kind of on your own. Of course, you can call the clinic, but you want to be able to summarize what was said and what you heard and be able to understand that when you get home. Tip number 4 is to write down your questions, bring those questions, but also ask clear questions. For example, if it seems like your doc isn't listening, ask a question like, what could it be? What are you thinking this could be? And also you can ask them to document in your chart why they're not doing something or why they're doing something, the reasoning behind it versus just getting a test or just prescribing a medication. That's a great way to have the things in writing. Let's say you print out your documents later on, you have those right in front of you. The most important thing is that you feel comfortable with the answers that you're getting and with the plan that you have with your provider. If you're not getting this and you have any doubts or any questions, I think it's appropriate to get a second opinion. And then you're able to formulate a plan that works best for you. So don't be afraid to talk to another provider, talk to another physician, because we want you to get to the bottom of this issue, especially if you're having pain. We don't want you to be in pain. So see somebody else if you need to, or if you have doubts or questions. Women's pain has been ignored for way too long. And by being prepared, asking questions, being clear, you will be able to advocate for yourself. And I want you to feel empowered when you go to these appointments because you deserve the best care. You deserve to have a great quality of life. If this is something that's interesting to you, and I'm very passionate about this topic, then make sure to subscribe and let me know what other difficult topics you want me to discuss in the future. Thank you for being here, and if you don't mind, please subscribe to this channel so that we can continue this discussion. I'll see you in the next one. Bye.